Welcome everybody to our Powerful People. We haven't done one in a little while, and super excited to have two real powerhouses on with us today. I think you're all really in for a treat. I'd like to introduce Sarah King, a physical therapist I've known for a long time and has had a lot of experience working directly with many people with Parkinson's and training people. And she's going to fill you in more shortly. And we have Sidney Collin, who is a biomedical engineer who came up with an incredible device that I think you all are going to want to hear about that will help with freezing. So before we get started, I thought, how about Sarah, why don't you go ahead and give a little background about yourself, and thanks for joining us.
Yeah, my pleasure. I'm so excited to be here. My name's Sarah King. I'm a physical therapist. I've been practicing for about 10 years, and I actually met Nina at the very beginning of Power for Parkinson's because I was starting my own physical therapy practice specialized in people diagnosed with Parkinson's as Power for Parkinson's was really getting started. So I had the honor of serving on the board for a little while early on. And so I've been following Power for Parkinson's, obviously supporting Power for Parkinson's for a long time. But my practice was called Invigorate Physical Therapy and Wellness. I closed that practice in the end of 2019. Did not know it was such great timing, but then COVID hit, and long story short, I also had a son during COVID, and so stayed home with him. And so now I am a physical therapist at Spero Rehab here in Austin, and work at a couple of the different locations. So I spent most of my time with Invigorate and before Invigorate, learning everything I could about how to help people diagnosed with Parkinson's immediately after diagnosis. You know, that moment of, I'm diagnosed, now what do I do to stay healthy and well? Had a variety of online programs for exercise, nutrition, core strengthening that all now live with a variety of Parkinson's nonprofits like the Davis Finney Foundation, the Parkinson's Wellness Recovery Foundation. And so I was away from patient care for a while and just came back about a year ago, and have been right back in it, seeing patients one-on-one and helping develop some Parkinson's specific programs for the companies that I've been working with. So I also support the Neuro Collaborative, which is a online virtual group of neuro-minded therapists, PTs, OTs, speech therapists, personal trainers that specialize in neurodiagnoses and helping. I was a co-founder, but when it started, and now Claire and Aaron have taken it and run with it. But yeah, just kind of love to support the neuro community. Obviously, Parkinson's is close to my heart, so I'm excited to chat today about what you can help yourself do for freezing, because there's a lot that you can do to improve your freezing. So thanks for having me, Nina.
Yeah, of course. Thanks for being with us. And Sidney, why don't you go ahead and fill in our audience about your background.
Sure. And yeah, I'm excited for this conversation with Sarah. I'm really excited to be here. Thank you for having us, Nina. So let's see, my background, I've always been kind of obsessed with understanding how the brain works, how the body works, how they interact. I studied biomedical engineering, and all of my research background was in brain-computer interfacing. So I did some research doing deep brain stimulation for people with Parkinson's for St. Jude Medical at the time, now Abbott, and did some research doing EEG neurofeedback for children with ADHD. And then I ended up meeting a person with Parkinson's who lived with freezing of gait and had no effective solution for it. And wanted to help him be able to walk around, be able to go to the bathroom by himself, be able to live his life, and made a device for him. We'll kind of get into the founding story later, I think, so I'll leave it there. But realized a lot more people needed it, brought it out to market, and have been the CEO and co-founder of a company called Spero Devices for about 4 years now. Got NexStride out on the market about 2 years ago, 2.5 years ago, something like that.
Yeah.
And have been doing that ever since.
Well, that's,
Sorry.
no, go ahead. Go ahead.
I was just going to add, I also, try and get as involved as I can in the Parkinson's community. So I also lead a support group in Austin, Texas, also for people with Parkinson's, to help make sure that people have the information that they need. As Sarah was saying, like from the moment that they get diagnosed, they're like, okay, what now? Where do I go? What are the resources? What are the tools that we have available? So try and do what I can to make sure that people have that information.
Well, that's awesome. Well, thank you so much. And I think that everyone who's with us today, it looks like we have people from all over the globe today. So Guatemala and Portugal, and we have California and New York. So I'm sure I'm missing some other people that are on today, but we're really excited to have a nice group. So I was just going to kind of kick off our conversation today, just to just talk a little bit about freezing and what it is. And I think, most of the people that are on today, I suspect that you either have Parkinson's or a loved one with Parkinson's. And as we all know, there's so many symptoms of Parkinson's. I mean, Parkinson's affects really the whole body in some different ways, and every person in different ways. And freezing of gait is one of those symptoms that is so difficult to manage, and probably one of the more disturbing ones for a lot of people, because it's tricky. So I guess I was just going to start by saying that freezing of gait, in case you don't know what freezing of gait is a feeling of when you get stuck, just get stuck on the floor, and you can't move forward. And often it's associated with falls, because sometimes your feet get stuck, but your body's still moving forward. And so, we're here today to try to help you come up with some techniques to try to deal with that situation. And it happens oftentimes if you're in a transition zone, like if you're moving from over a threshold, or from a tile floor to a carpet floor, or you're in a tight space, or turning around, or feeling anxious, or just initiating gait, or getting up from a chair. Those are some of the most common times that will happen. And for some people, it happens as their medication is wearing off, and some people it can still happen even if you are adequately medicated. So it's a tricky thing to manage. Sometimes DBS doesn't necessarily help that problem. So today we're just going to talk about how we can how people can cope with this. And there's a lot of different complicating factors in gait that have to do with the brain circuitry, and which is a very complicated process. And for most of it's automatic, but in Parkinson's, that isn't necessarily what happens. So I thought I would just kind of start out by asking, either one of you could start it off, but just when do you see this the most? What has your experience been with clients or patients of yours? I don't know.
Happy to lead off, unless you want to, Sydney.
Yeah.
No, go for it.
Okay. As a physical therapist, it's interesting to assess someone diagnosed with Parkinson's. I think the statistic is that 50 to 53% of people diagnosed with Parkinson's within the last 5 years most likely have some type of freezing of gait. It varies by, do you have traditional Parkinson's or atypical Parkinson's? But a lot of people don't. If you ask them, do you have freezing? Sometimes they're like, I don't think so, but they do. And so it can feel like you have dead legs or heavy legs, or your feet are stuck to the floor. There's also festination, which is kind of like a cousin of freezing, which is your feet don't necessarily get stuck, but they start to go really fast in really small steps. That's called festination. And So something that you can do if you don't know if you have freezing of gait, that's a quick screen, is actually just try and turn in a 360-degree circle. You can turn clockwise and then try and go counterclockwise. Typically one direction is easier than the other. And if you aren't able to make it around, and we kind of look for 4 steps or less, and your feet get stuck and you have trouble moving them, that's actually can be a sign of freezing of gait. Like I said, within 5 years, it's about 50%. With advanced Parkinson's, it's closer to 80%. And so from my experience working with people diagnosed with Parkinson's, this is one of the most debilitating and frustrating symptoms, because it can be such a public thing. Some of your Parkinson's symptoms you feel, but maybe other people can't see. People can definitely see you and you freeze. And so that builds some anxiety, and that can layer things on top. So in my experience, there are physical components of freezing. There are some cognitive components of freezing, and then there's some emotional, mainly being anxiety and fear, that can contribute. And there was a study, and I would have to find it again to know who it was by, but kind of developed this mindset, or this classification system. There are 3 subtypes of freezers. There are people who are predominantly limited by their physical. Maybe you have slow movement, maybe you have dyskinesia in the morning is definitely one of the bigger freezer predictors. Maybe you have decreased range of motion, small movement, and that's what's causing your freezing. Then there are people who are predominantly anxiety freezers, who maybe their physical symptoms aren't so bad, but their anxiety, when they get going, their anxiety actually freezes their ability to walk. Sorry, no pun intended. And then cognitively, there's a lot of problem solving that has to go into a Parkinson's diagnosis, because you have to start overriding your body's you don't have that automaticity, that automatic ability to do things. And so you do have to cognitively problem solve and dual task. And sometimes when you have mild cognitive impairment up to dementia, that can cause your freezing. And so as a physical therapist, my job is to screen you and figure out maybe where you actually freeze, why you're freezing. Is it physical? Is it cognitive? Is it emotional? And then build a treatment program based off of your specific impairments. And so we bucket everything into, do you freeze or do you not freeze? But there's a lot of ways to kind of pick through how to help people not just get unstuck now, but to build a program that helps them improve and freeze less over time. Well, that's my experience. Mm-hmm.
Yeah.
Well, I will say Dr. King is definitely the clinician here, so I will make sure that hand it off to you to talk about any of your experiences with patients in the clinic. So all I can really do is recite research. I spend a lot of time looking at research papers, looking at what's online, what's kind of explaining what's going on with people. And what I've seen is, first of all, with my personal experiences of just, the few people that I have in my life that have Parkinson's, it's, a lot of like walking through doorways, walking into elevators is something that I've heard a lot. This is all anecdotal. Mm-hmm. And then, as Sarah was saying, also the anxiety, excuse me. I know that for one person that I can think of, whenever someone would tell him, hurry up, he would immediately freeze, that fear of, oh man, like I need to do this faster, and then not being able to do it. But in terms of what I've seen on the research side, what's happening with freezing of gait is that with the lack of dopamine in the brain, the basal ganglia is having a hard time processing those signals. So the signal doesn't actually get from your brain to the motor neurons that are activating the muscles in order to actually initiate movement to start walking. So there are, I think we'll probably get into treatment options later. But what we've found in the research is that what we can do is you can bypass that part of the brain by activating the goal-oriented neural pathways instead of the automatic neural pathways, because automatic neural pathways is what people are struggling with the most. A lot of these automatic movements become really hard for people with Parkinson's. So we want to try and activate different parts of the brain to initiate the same movement.
Well, that's, I really like the way you brought that up because, I mean, of course, and then along with what Sarah's suggesting is that people can come up with a plan and do something to help themselves. So that's what we're hoping, everyone who's on today, that we can try to give you some tools that might help you overcome this really complex problem. And, since I knew we were having this conversation today, and I tried to do a review of the literature in advance, and it just, really seems that it's still, the reason why, I mean, like you said, Sarah, I mean, Sydney, I think, there are some indications as to why this is happening, but it's still, a lot needs to be, teased out still.
Definitely.
Because it's so complex, and just walking is much more complex than you might think it would be. I guess with that, I mean, maybe we can, I see several people are commenting about when they have their freezing, and, again, it's going through a threshold, crossing the threshold. And I see that one person was saying that she has trouble in the afternoons, and when it rains happens to trigger her. And I know that it can be, different people respond in different ways. It's so I'm sure it's very frustrating when that does happen. So maybe we can kind of get into, maybe Sarah, since you're the one, you're usually at the front line in treating. So what would you, how would you kind of get started, or what are your usual kind of tips that or how do you help somebody right from the beginning to kind of cope with this problem?
Yeah. Yeah. So there's a kind of a layered approach. I think the way that I approach it is teach you right now how to get, you're on fire. Let's teach you how to get all, not on fire anymore, put out the fire, which is, how do I get unstuck from a freezing episode right now today? And that's kind of the short-term strategies. And I have like a 5S method that I coach people through, 5S method. And then there's like the long-term, how do you actually change your brain so you freeze less in the long run? That's more work, and I'm happy to talk about all of the things that go into that. Part of that is optimizing medication. Part of that, again, is figuring out, do you have enough endurance? Do you have enough, aerobic capacity? All these different things. But short term, I like to teach people, first of all, to wear good shoes. I know Crocs are all the rage right now, but if you freeze, please don't wear Crocs. Please take them off and throw them away and never wear them again.
Good point. Yes.
Right. Yeah. So if you wear loose fitting shoes or slippers, Crocs are big because you're pretty much walking on a cloud. You can't really feel the floor that well. They stick. They don't really slide. They kind of come off. So nice fitting shoes with some traction are my first recommendation. So I just look at your footwear. The second thing that I coach on is the 5S method. So if you get stuck, the typical thing that happens is you try even harder to get unstuck. You look at your feet, you lean over, and you try to go move your legs a little bit faster, and suddenly your shoulders are going faster than your feet are, and there's just all kinds of things that could happen that are not good there. So the 5S method, anytime you get stuck, the first thing, if you notice your feet are going really fast or they're stuck to the floor, just stop trying to move. Just stop completely so that you can reset. That's the first S. The second S is shake it off, which just means relax. Like we talked about, anxiety can really drive up, for a lot of people, your freezing instance. And so stop, take a deep breath, shake it off. The third is stand tall, because when you stand tall, you actually put weight on your heels and you're able to take a better step. There was a study that tried to induce freezing in healthy control, so not even people that have Parkinson's, by having them lean over and then moving something out of their feet, people's feet got stuck because you're not in an optimal position to catch yourself. So when you stand up tall, you shift your weight back onto your heels, just off of your toes, so that your toes can kind of wiggle a bit. You're going to shift your weight. So, and I'll show you all of this. I just wanted to walk through it. You're going to shift your weight. And what I find is that people need to slow down to shift their weight a little bit, which is counterintuitive, because with Parkinson's, we're like, we need to move faster, because we're slow, bradykinesia. But you really need to take a nice slow weight shift all the way from your right foot to your left foot until you can feel your feet getting lighter. And then you take a big step, which is the 5S, the 5th S. So let me see if I can get everything in my view here. And I might cut my.
Wait, I'm going to spotlight you for a minute, Sarah, so everyone can see you better.
Let's see.
For this. Here we go. There we go.
Okay, I'm gonna back way up. Okay, so we're walking and your feet get stuck to the floor. You're trying really hard to move your feet and they're not going anywhere. Sometimes we do this little shuffle and we hear our feet. Whenever you notice that, just stop. Then you're gonna shake it off. Just take a nice deep breath. Shoulders back and stand tall. And then you're gonna shift your weight into your right foot and then your left foot, nice and slow, side to side. And if you have somebody with you, because it's hard to feel where you are in space sometimes, you can have somebody just at your shoulders kind of guiding you side to side. And let's see if I can back up far enough. Actually, I'm just gonna point you down so you can't see my face. You can only see my feet. I got new shoes recently, so you guys can check out my new shoes. Okay. So I'm shifting my weight. And if I shift my weight enough, my foot will naturally come off the floor just because my legs are only so long. So you want to shift significantly till you feel lightness on the bottom of your feet. And then once you get a good weight shift, the next part is driving your knee up to take a step forward. So that's the 5S method. You can ask questions in the chat. I can't actually see the chat, but you can ask questions. That works for, I would say, 80% of people, 80% of the time. I think Sidney can probably speak to some of the visual and auditory cueing that can help in those moments too. So I won't steal all of Sidney's kind of highlights about what she works on too. But when you're trying to take that step, the NexStride, I think, does this well. But having something in front of your feet that gives you a visual cue that you can step over. Sometimes, you can put a piece of tape under there, obviously, or somebody's foot can go right in front of you to step over. Auditory cue of a metronome or singing a song like Ants Go Marching, the Ants Go Marching 2 by 2, can be a good thing to kind of tune your brain into to start trying to hit on the beat. But I'll pass that off to Sidney as far as like the visual and auditory cueing. But that can help a lot of people get unstuck and quickly. And once you step, you want to think about taking the longest steps possible and with good quality. So once you get unstuck, keep those legs moving, nice and long steps, and that should help you avoid getting frozen as you move forward.
Well, thank you for going over that. And I found your old video on your site that has the 5S method, which I thought we could we'll link in this with this interview also, so people can access that, because it's a good.
Oh, it's so good. It's such an old video.
Yeah, it gives a great. It still works, I think. So still relevant today. But I hope people try to remember that, because I think it's so good. And just with Power for Parkinson's, we have a lot of in-person classes and run into a lot of people who have trouble with freezing, and we have to train our volunteers how to manage people, because they might sometimes we have people that get stuck in a chair, or they get stuck in walking in or out of the class. And it's and every person has a little different trick. So I think it's really when somebody has a partner to work with, that of course is the ideal situation because they can help guide the person with Parkinson's. But I think learning those tricks early on and kind of figuring out what works for you, for the person, is the best scenario. So they can, every time that happens, they can go back to their trick to get going. At least that's what I've seen. I don't know.
Yeah, 100%. Yeah. Everybody's got something that works for them, and everybody's a bit different. I had a patient once who did really well. Only if you told him, like, between here and the door, you need to only take 6 steps, and he could, as soon as he knew where he was going and how many steps he could take, he was off. But, it's trial and error. It's trying a bunch of different things. And it is we probably say this too much as physical therapists, but working with someone who specializes one-on-one with somebody who specializes in Parkinson's can be really effective to help you find what, work through some different things so that you're not just beating your head against the wall, trying to figure it out. Somebody can help you streamline and get there a little faster to whatever works for you.
Yeah, definitely. Well, I think, what you were starting to talk about having, setting a goal or having a line or something to focus on to move would be a good segue to bring Sidney in to just talk about, let everybody know what that device is that you've developed and how it came to be and how people can use it.
Yeah, so I'm getting it set up on the cane right now so I can show you guys. But yeah, I think so. Just in general, right before I dive too much into NexStride, from the research, again, I feel like I have to keep saying this, but I am not a clinician. All I do is recite research that I've read online, right? So there's lots of great peer-reviewed articles out there, there's lots of great research, but I am not a clinician. That being said, from my knowledge, there's lots of different types of cueing that people can use. There's internal cueing and there's external cueing. And so a lot of what Sarah's describing is, well, it can be internal, external, depending on who's helping you, stand up and weight shift and do all of these things to help get you going. And then there's also external cueing that you can add in. And these are all, like, as Sarah says, as Nina's been saying, everybody with Parkinson's is different. And what's going to work for you is going to be different than what works for the next person. And so it's really about understanding what are all the tools that you have available to you and what is going to work for you to help you do whatever it is that you want to do. And so when I met this person with Parkinson's who had freezing of gait and, was having trouble going to the bathroom by himself, going a walk with his wife, Sandy, his name was Jack. He actually came to me and said, I know that there are these visual and auditory cues that work because I use them in my physical therapy clinic every week, but then when I come home, I can't walk. And so he came to me with the knowledge of these visual and auditory cues already. He said, he actually used to be an engineering professor. And so he said, Sidney, I know that there's a way that we can make this portable. Let's work together and make this device so that I can walk to the bathroom, so that I can go on a walk with my wife, Sandy, so I can do all the things that I want to do. And so me being the research nerd that I am, started to look into the research, and I found, okay, there's over 100 peer-reviewed articles that have been published showing how effective visual and auditory cues are. They're standard of practice in almost all physical therapy clinics across the US for people with Parkinson's, specifically putting down, as Sarah was mentioning, parallel lines of tape on the ground, marching music, songs that people are singing. But there was no way for people to use those cues outside of the physical therapy clinic and have tools to be able to continue to use those at home, outside, wherever it is that they work. So what we did was take the most effective visual and auditory cues from research combine them into a small portable device that can attach onto any cane walker or walking pole and allow somebody to have access to those cues no matter where they are. So the device itself is a small device. It's about the size of a palm, right? You can see that here.
And I'm going to
So
spotlight you now. There we go. There we go. So they can see better.
It's called the NexStride. It attaches onto any cane walker walking pole. So you can see me attach it here. You just take this rubber band and you loop it around. And that's the device that's attached right there. And then it connects to this little, we call this the hand controller, but it's just two buttons. One for the visual cue, which is a green laser line, and one for the auditory cue, which is a metronome. And the reason that we separated it into two parts is so that it's super easy to activate. If you're frozen, all you have to do is move one of your fingers to activate either the green laser line or the metronome, and it'll turn on for you and you'll be able to overcome that freeze, hopefully. That is the goal. So I'll kind of show you, I guess before I actually get up and show you this device though, I should explain a little bit more about visual and auditory cues. So I told you they're standard practice in physical therapy clinics. We have over 100 peer-reviewed articles that have been published showing how effective they are for people. They've been shown to reduce falls for people with Parkinson's by 40%, to reduce the duration of freezing and gait episodes, for how long you're frozen, by 43%, sorry, by 69%, and the frequency of episodes from coming on by 43%. So not only can they help you get out of freezing episodes quicker, but they can also actually prevent freezing episodes from coming on in the first place if you're using the cues continuously to prevent freezing. And the way that these cues work is what we're trying to do here is we're trying to activate the part of the brain that responds to goals versus the automatic part of the brain. So instead of just thinking, okay, I need to get up and walk, you think, let me step over this green laser line. Let me step to the beat of the metronome. And that change of intention, the change in how we think about the movement, actually changes the part of the brain that's being activated and allows someone to be able to restore mobility. So with that being said, the visual cue that we have is a green laser line that's projected onto the floor in front of you. Let me see if I can turn this light off. I'll show you the floor. Okay, so we have a green laser light here. You can change the location of the light, so you can move it right or left, whether you're, right-handed or left-handed on the cane. And you can also move it front and back. So I can push it out, let's see, can I step back here? I can push it out. This is like 3 or 4 feet in front of me right now, or I can put it right in front of my toes. And you try and step over that green laser line. Or you can, if you have it out, you just want to step towards it. You want to step towards that green laser line. And then we have the metronome. And you're going to have complete control over the cadence. Can you guys hear the metronome? Yeah, okay. I have you on my AirPods, so I'm not sure you can actually hear it.
Yeah, I can't quite hear it. But
okay,
yeah, it's not coming through.
Okay, well, you can control the cadence of the metronome. So the speed of the metronome, and you can control the volume of it. So the idea here is we wanted to make something that was as customizable as possible, right? That people can use on any cane, walker, walking pole. They can change the location of the laser line. They can have it out in front of you. They can have it right in front of their toes. As Sarah mentioned, sometimes for, we don't want people to have the posture of hunched over looking straight at their toes, which is why we made the laser able to go out a couple feet in front of you so you can keep your posture up and still have that visual cue to walk towards. And really, we just want this to be a tool for people to be able to have access to the cues that they need whenever they need them. So I hope that was an okay high-level overview. Didn't get too much into the details there.
No, I think that's I think that's really great. And I love how portable it is and how adaptable the device is. And they've had I believe the youth step for quite a while, which is a heavy walker, really heavy, that has a laser that you can attach to it. Sarah, I don't know if you've had experience. I think you know people that have used it, the U step before. But I like the possibility of the metronome being so accessible and the laser light that you can take with you. So that seems, I'm so glad that you followed your brain took you in that direction. How innovative you were, Sidney, to really come up with such a unique device to help people.
Honestly, it was all Jack. I am just the one that built it for him, but it was definitely his idea.
Yeah, well,
yeah, it's cool.
It's really cool, and that's what we need. So until there's a cure for Parkinson's, and we just want to try to do whatever we can to help people live the best life they can and get around be as independent as possible. So I think that's I think that's a device that probably someone would use if they're really having a lot of freezing and really having trouble walking. So thanks for showing that. I'm curious, or just because of all the exercise that we encourage people to do with strength and gait, we're always really pushing all that endurance as well that you mentioned, Sarah. I mean, do you see people, if they get the more they work on their fitness, is their freezing improved or lessened?
Yeah. Yes, for sure. Like Sidney said, there's so many wonderful articles out there now. I feel like Parkinson's research has really blossomed in the last 10 years, especially 5-10 years. But yeah, when it comes to kind of treatment strategies, it's pretty common across the board. If you have lower aerobic endurance, just what we call functional endurance, just the ability to even maintain nice long strides for 5 minutes, 10 minutes, that ability to maintain quality movement is endurance. Aerobic fitness is, can you maintain that 65, 70%, 80%, 85% of your heart rate max? So they're a bit different. They can overlap for sure, but people who have low tolerance to just activity and being able to move their bodies continuously with high quality, they're more likely to have freezing of gait. And when you can build that endurance and that aerobic fitness baseline, that can definitely improve freezing of gait. Something that I think goes overlooked a lot of times is just optimizing medications as well. Being optimized with your levodopa, typically freezing of gait happens more likely to happen when you're off. It can definitely happen when you're on. And levodopa, making sure that you're optimized. And there's a really cool calculator that can tell you kind of your fluctuations in your levodopa. And what I'll do with clients is I'll have them put in all of their medications, their levodopa equivalent dose, and figure out, you always freeze. Like I had a client who only froze after like 9:30 or 10 when he was getting ready for bed. And we kind of figured out that he was almost like tanking on his levodopa dose. It was because of what he was eating and protein, interaction and all the things. And so, if you just target the superficial, just like, you should build your endurance, but you don't look at optimizing medication, sometimes you can miss the low-hanging fruit. So I'm happy to share that calculator too. Maybe everybody kind of already knows about it, but we look at making sure you're optimized medication-wise. If people are waiting to see a physical therapist, something you can do is, get on a bike. If it's safe, maybe not freezing of gait, but treadmill training is actually pretty effective for freezing of gait if you can do it right. An elliptical can be a nice, safe option. A new step, something to build your endurance, just getting on there every day, trying to get your heart rate up. Start with 5 minutes twice a day, build up to 10 minutes twice a day. If you can get up to 30 minminutes, sorry if I'm going on a tangent. Did you want me to be brief?
No, you're fine.
Okay.
You're fine.
Okay. Just cut me off if I'm talking.
No, you're fine.
Okay, awesome. So building up that aerobic endurance, you can do that now at home in a safe space that helps you build up your ability to tolerate moving 5 minutes, 10 minutes, 15, 30 with good quality movement, nice, big, large amplitude movements. Something that I really like to do with people who have freezing is get them to move in that high amplitude way, which just means like as big of range of motion as you can go through, nice, big, powerful movements. Most of the time I try and get people to do those things on their stomach or their back or even on all fours, because that reduces a lot of anxiety. If you're having a lot of freezing, I typically don't start with training you walking. We typically get down on the floor and make sure that you can move really well in a supported space, which is usually on your back or on your stomach or on all fours, just depending on the person. And so doing that on top of your aerobic training 3 to 5 days a week. Power for Parkinsons, I think, is a really, like, shout out to Power for Parkinsons. A lot of classes are seated, so it's supported and you can practice those big amplitude movements. They're definitely cognitively challenging and aerobically challenging. I can say from firsthand experience, I've attended classes. So something like that 3 to 5 times a week, and making sure that you're practicing those big amplitude movements. You will have to eventually progress into practicing what we call overground walking. In order to get better at walking, you've got to practice walking in a safe and supported environment. So my recommendation for people is to not continue to practice something you're failing at. If you're just determined to be able to walk through a door without freezing, and you just practice over and over and you just keep freezing, even with visual and auditory cues, if you're practicing without good performance, you're just reinforcing bad performance. And so we need to find a space for you to be successful. I really like treadmill walking. Like I said, Spero has a body weight support treadmill, which is new to me. I never had one in my practice. And so that's very exciting to kind of get harnessed up and be supported for that treadmill walking. So yeah, to answer your question, building your fitness and just your ability to move and tolerate movement is going to help with freezing of gait. And then you need to practice the things, improving the things that are probably layered on top that are contributing to your freezing.
Great.
Mm-hmm.
Well, that's exactly what I want to hear.
Yeah.
And that's what we see. I mean, we see people getting so much better. The more they exercise, the better they feel.
Yes.
But
can I also throw out one thing to add on to that exercise is the only thing that has been shown to slow the progression of Parkinson's disease, right? We have all of this medication, we have all of this other things that can help mitigate the symptoms, but the only thing that has been shown to slow the progression of Parkinson's disease is exercise. So like what Dr. Sarah King is doing, what Nina's doing with Power for Parkinson's is giving people the ability to actually slow the progression of the disease.
Yeah. Well, that's has to be, I mean, I think everyone who's on here today is probably exercising a lot, I hope. And we'll keep challenging people to improve their gait and their strength, endurance, their multitasking ability. But I do think, having these, for people to know that to work one-on-one with a physical therapist can be extremely helpful in guiding them, especially for these really challenging symptoms. And then, at a certain point, if you need the device to really help you, if it really interferes in your life and having trouble moving around. I know that my father, became, he, in his advanced years, could have used a device because he was using a walker exclusively to get around. So, and I would always have to tell him, or somebody would have to tell him, walk into the box or walk up to the walker, because it would get ahead of him and he couldn't catch up to it. So I think having that laser or having the metronome could be a really helpful tool. So, Sydney, just talking about that, I guess I wanted to know just about the NexStride, and if somebody wanted to get the NexStride, buy one, or and I guess people who are in Austin can try it right here in our office because we have one, a tester.
Yep.
Test.
Yep. And we also give out free demos to all physical therapy clinics. So Dr. King, if you would like one, let me know. We can give you a demo so you can use it with your patients as well. But yeah, so it's available online. We have our website is getnexstride.com. It's $499, but Nina has a discount code for people that she can post and make sure everybody has available. The couple things that I think are important to mention, it's 100% covered by the VA. So any veteran can get the device for free through the VA if you get healthcare services through the VA. If you have any questions about that, please contact us or call us. I know that the VA can be a hard system to manage. The other way that people can get coverage is through an organization called the Parkinsons Wellness Fund. Will also help cover the cost for anybody who needs financial assistance. So if you think that you might need an NexStride, or you think that somebody you know might need an NexStride, please reach out to us, and we can make sure to get somebody an NexStride no matter what their financial situation is.
Well, that's great to know, and we can we'll add all those links in. So Iris is asking how much it is, which she said was $499, but we have a discount code which we'll give you, and there are ways that you can have that covered from the Parkinson's Wellness Fund. They will cover it for people. So that's really good to know.
Yeah.
And let's see, we have had a couple, or at least I saw one question here. I think this one might be for Sarah. Luis said that he walks on his toes. Do you have any tips to use the walk more heel toe? I think it's
to walk more heel toe.
Yeah.
Yeah. If you tend to walk on your toes, the first thing that I look at is posture. It can be related to a lot of things. You might have some like rigidity in your calves, but typically if you're more of a toe walker, it tends to be because you're leaning forward quite a bit when you walk. That can be posture related. It can also be proprioception and sensory related. But for you, Luis, I would probably, before I even tried to gait train with you, teach you how to walk and give you tips, I would get you down on a mat and we would practice just some, I'm trying to think of how to explain it without just telling you the power moves on your stomach. But there are moves on your stomach that you can practice, pushing up, you can practice twisting. But I would, if you have a set of floor exercises, maybe that your physical therapist gave you, or I don't think Power for Parkinson's has a video that does floor exercises, but I can look up Luis and maybe post in the chat some exercises that we do in therapy that you can try. Without knowing a lot about your situation, it's hard to prescribe exactly, but again, we're trying to give you a better sense of where your body is in space so that you can stand more upright when you are standing. And there are a series of exercises that can help just flush your brain with all kinds of sensory information while you're on your stomach and on all fours, to practice some stepping there. Something that's kind of a short-term thing is doing like a power up, which is a fancy kind of label for a squat to stand, but it can sometimes help people get off of their toes. So I'll just demonstrate it back here. And so I'm way back here. So if you tend to be forward, kind of on your toes this way, you can do a little mini squat here and bring your arms way back, push your hips forward and try and bring your shoulders back. And just doing that a couple of times, 10, depending on your your endurance again, 10, 15, 20 times even, can help retrain your body into a nice tall posture short term. And so you might find yourself after you do those power up exercises, about 20 in a row, that you have your weight more back on your heels or midfoot. I don't want you back on your heels because we'll have the opposite problem, but equally distributed into your foot, and to see if that can help you before you walk get a better heel toe pattern. So Luis, you have to try it and report back in the chat. But that's where my brain would go for you, Luis, is power up, just like those power squats that I just did before you walk, to see if you can hit with your heel a little easier. And then if not, get down on the ground, and I'll see if I can find a link to one of the videos that I'm talking about from the Parkinson's Wellness Recovery Program, which is very similar to the big program for those of you that don't know.
Great. Well, I think that was good advice. So let's see, I have, Grace, I just want to reply to Grace and just clarify something, because she asked, is freezing associated with off episodes? And I think the majority of the time, yes, it is, but it definitely can happen to some people, even when they are on. So,
and yeah, that's a medication optimization sometimes. I mean, if you have advanced Parkinson's and, that's maybe a different story, but optimizing your medications and making little tweaks to your medications may help. Like, you might not be totally optimized for the day.
It's worth definitely working with your movement disorder specialist to try to get to that point. So I think, the bottom line with all of this is just coming up with, well, if you have the opportunity to work with a team, your physical therapist and your movement disorder specialist and anybody else that you can work with, is really great to help you develop a toolkit to manage all these different symptoms. And if you need, if a device is something that can be helpful, again, just trying to maximize your fitness, maximize your medication, and then any other tools that can be helpful for in this situation. So let's see, Iris is asking, so she knows someone who has limited funds, and we will put that other organization, the Parkinson's Wellness Fund, in the chat. They're a great organization. They've been sponsors for us for a long time, and they really help individuals with Parkinson's. So Iris, we'll let you know what that is. Okay, so I don't think we have any other questions. Do either of you have anything else, parting words for the group?
I did have one last thing that I meant to mention when you were asking about effectiveness. There is a lot, I think it's probably more anecdotal at this point. We need a lot better research to support this, but clinically, what I've seen, and I know a lot of my Parkinson's, fellow Parkinson's PTs have seen, and they do this for that reason, is you can do intensives. So freezing intensives, because they've found that if you are able to tolerate 5 days in a row of Parkinson specific exercise, freezing specific exercises where you're working on overground walking and weight shifting and multi-directional stepping and floor transfers and relaxation training, and 5 days kind of condensed training in a row, the before and after, even just 5 days of intensive therapy can make a big difference in your freezing of gait, 4 weeks post, 6 weeks post. And so something that a lot of people say is like, well, I'm gonna have to work forever to improve my freezing of gait, and you will have to work pretty hard. But even just short bouts of intensive exercise can really make a big difference. So I just want to throw that out there, that there is hope, and you don't have to think about doing it, working hard 5 days a week for months and months at a time. You can make a big impact in a short period of time.
Yeah. And Sarah, do you have recommendations of intensive programs that you know of? I think PWR does one, is that right?
Power does them. Yep. We can do them at Spero. It's just a scheduling thing, but Power, they have a freezing intensive at their gym in Tucson, Arizona. That's awesome. If you are near California, Rogue Physical Therapy and Wellness, I think they're in Fountain Hills. No, that's in Arizona. I forget where Claire is, but just look Rogue Physical Therapy and Wellness in California. She has an amazing clinic out there that she can do intensives there. We're in Austin, Texas. And I think if you know a Parkinson's physical therapist and they provide physical therapy services, there's a good chance that they will be able to offer you a 5-day-a-week program. You just need to ask. Yeah.
I think that's really good to know and to share with everybody. We have Hafitza just got on and said she just started freezing suddenly and very intensely. Is it temporary or forever? And I think it might be something that you're going to have to deal with, but you can lessen it with some of the suggestions that we've talked about today. I don't know if you've been on the whole time, Hafitza, but either working with a physical therapist like Sarah was talking about, or really exercising pretty rigorously can help you, and working on your gait, like we spoke about earlier, can help you counteract some of the freezing that you're experiencing. And you might want to check in with your doctor too, to make sure that your medications are maximized as best possible, because sometimes it requires a tweak of your medication and it can get a lot better. So I hope that answers your question.
Yeah, I think to jump in there too, and y'all can share your experience, but typical Parkinson's is a very slowly progressing diagnosis. Obviously, the atypical Parkinson's, like PSP, can present a little differently. But typically when someone tells me I just had this huge exacerbation in my symptoms, I sometimes look for something else that might be aggravating your system, like a UTI or dehydration or pneumonia, or you've had a big stress in your life, because typically as the disease progresses with typical Parkinson's, it doesn't usually just spike into severe freezing one day and you didn't have it a couple of days ago. So I don't know if Nina, you have opinions about that, but typically when someone says they just had a severe exacerbation of their symptoms, that's not typical Parkinson's, and that might be like an underlying thing. Of course, exercise is always going to help no matter what, but you might kind of check in, is there something that's changed in your environment or your emotional state or physical state?
No, you're absolutely right. Yeah, any little thing, infection or some kind of change in your system, any kind of illness can really trigger your symptoms more than you normally would. So that's a really good point. And then Lisa was asking if this can help for MSA, and I think all these things can help, and so you can use similar techniques for MSA as well.
Yeah. We're actually publishing a case study right now with, I think this one is with Vanderbilt, but I'm not sure, but with MSA, showing, we've had, this device is not only effective in Parkinson's, but we've published research in stroke rehab and cerebral palsy, multiple sclerosis, PSP, and MSA is one of them as well.
Oh. All right, that's good. And I'm glad you're testing it. Well, it looks like we're getting a lot of positive feedback. I think people have enjoyed talking to you, just like I have. And I know you both have shared so much great information. And this will be up on our website. And we, for everyone who's watching, it's going to take us, we have to add some of this content. It will take us a little time, but we will get it up, and hopefully within the next couple hours. And I can't thank both of you enough. You both have made a tremendous impact on the Parkinson's community with your work, and I'm very grateful for everything that you've done. So I look forward to working with both of you in the future.
Thanks so much for having us, Nina.
Yeah.
Yeah.
Keep doing the great things.
All
Yep, yep,
right.
yep, yep.
Yes. Well, good to see you. Thanks everybody for watching.